Hi, my name is Monet Fayeweather. Today is January 20th, 2022, and I am going to be performing a head to toe assessment. I've already performed proper hand hygiene on my previous video. I'm now knocking on the door to enter and providing privacy. Hello, good morning. My name is Monet. I'm going to be a nurse today. I'm going to do a head to toe assessment. Is that okay?
Yes.
Okay, can I have your name and date of birth, please?
Alex Machado, 11/3/86.
Okay, and can I just check your bracelet? Okay, perfect, thank you. Okay, and they match. Are you in any pain today?
A little bit, yes.
Where is your pain?
Lower back pain.
Okay, can you describe the pain for me on a scale of 0 to 10, please?
It's about a 3.
Okay, so a 3 on the lower back. Is there anything that makes it better?
Heating pads and rest.
Anything that makes it worse?
Sitting in the chair.
Okay. Okay, can you tell me where you are right now?
Lincoln Tech.
Lincoln Tech, and what's the year and who's the president?
2022, and it's President Biden.
And what season are we in?
Winter.
Okay, patient is at line oriented ×4. I would then don on some gloves and inspect and palpating the scalp and here for lumps, bumps, bruises, lesions, or broken skin, dandruff, and it looks good. Going to ask you just to frown and smile, puff out your cheeks, and raise your eyebrows. During that time, I would remove my gloves and perform hand sanitation or hand hygiene. Okay, and I am going to just assess your eyes. With this, I'm going to be checking for perla, which just makes, see if your eyes are going to react, okay? Do you have any vision problems?
Sometimes I wear glasses.
Contacts?
No.
Okay, no contacts, never? Okay. I'm just gonna assess your sclera. Don't mind the light. Sclera looks white. Okay, and you just pull down the lower lids. Perfect. No drainage, conjunctiva pink and moist. The pupil size is equal on both eyes. The iris looks okay. And I'm just gonna go ahead and do this one more time to see how your eyes react to the light. Equal and round both sides, and I just want you to follow this for me. And I just want you to follow this. Okay, perfect, and they accommodate. Perla is complete. I'm gonna move on to your ears. I'm just gonna be checking for drainage. They look equal. The skin's intact, and I'm just gonna pull back and up. Palpate the pinna. Palpating the pinna. No drainage on either sides. Both pearly gray. Tympanic membrane looks good. And no pain in the ears, right?
No.
Okay, pale gray also. I'm then going to just check the lining on the nose. It's midline. I want to check for patency, which will just have you hold one side and blow out, and on the other side. Okay, it's in line, not deviated, and patency is good. I'm going to move down to your mouth. So can you just smile? Okay, teeth look good, no broken teeth. Before, I just want to go back to the nose, I'm sorry. I just want to check for drainage. Okay, no drainage. Just open your mouth for me. The lips are moist, pink. The tongue is moist. It's pink. No cuts. Buccal mucosa is good. Gums are pink. Can I just see your gums? Okay, good. Thank you. They look good. No mouth pain, right? Okay. I'm going to go ahead and check for lymph nodes. I like when it does this. Okay. I'm checking for skin turgor. No dehydration. And I want to check for JVD on the right side. And I'm assessing the trachea, midline. Okay. No swollen lymph nodes, no pain when you swallow or anything, right? No JVD, 45-degree angle. Okay. I did skin turgor, no dehydration. Can you just pull out your arms for me? Okay. And then I just want you to push down. And I'm gonna push up and just, okay, that's good. Let me just check for range of motions, bilaterally, strength on both sides. And can I just have you shrug and rotate and forward in the wrist, other way. And you can bend your elbow straight, okay. I'm just gonna check and have you squeeze. Okay, pull. Okay, range of motion is good. I'm gonna listen now to your lungs. Have any shortness of breath or coughing?
No.
No pain when you're breathing?
No.
Alright, I'm gonna have you take a couple of deep breaths so that I can listen, okay?
Okay.
Deep breath. And again. Perfect. I'm gonna check the front now. Okay. Lungs sound clear, no wheezing or crackling and no pain, right? Okay.
No.
On exertion or insertion, right? Okay. Do you feel like you've had or experienced any dizziness?
No.
Alright. Alright, I'm gonna take a couple of more listens to your heart sounds, is that okay?
Mm-hmm.
Alright. Okay, I'm gonna start with the aortic valve. Moving on to the pulmonic on the okay, and we're gonna go down to third intercostal on Erb's point. And the fourth intercostal, which is tricuspid. And the fifth is the mitral valve, where we'll listen for the apical pulse for 1 minute. Okay, we have about 78 beats per minute, and the rhythm is regular. No abnormalities or irregularities. Can I just assess your radial pulses? Strong and bounding bilaterally. And I just want to check for clubbing and capillary refills for less 2 to 3 seconds. And no clubbing. Capillary refills intact. No bruises or cuts. Skin is intact. I'm going to ask you some questions about bowel movements and voiding, which is urinating. When was your last void?
About an hour ago.
Alright, any burning, any uncomfortable, okay.
No.
What about any bowel movements?
This morning.
Okay, was it, like, what form was it? Constipated, was it runny, was it normal?
Normal.
Okay, was it, a weird color, what color was it?
Brown.
Okay, any nausea or vomiting?
No.
Okay, and your urine, was it, a normal color, clear yellow, or
Yellow.
no strong smells, or,
No.
okay. Good. I wanna just do an abdominal assessment, just to ensure everything is okay. Gonna listen, and, I'll palpate after, okay? Gonna have to take vowel sounds. I'm expecting without looking. Looks flat, not distended. No stomach pain, right?
No.
I'm gonna start by listening in the right lower quadrant to the right upper quadrant. Listening for 5 to 30 clicks through each quadrant to the left upper quadrant and to the left lower quadrant. Vowel sounds are active. If they were hypoactive, we'd listen for a minute and 5 minutes in each quadrant. Now I'm just going to palpate the abdomen. No pain, non-tender.
No.
Okay. Non-tender. It's soft, it's not distended, flat and non-tender, and no pain. Okay, perfect. I am going to move on to your feet. I do have to just check each toe for capillary refills like I did to your fingers. And I'll just do that to each toe. Okay, and I'm gonna check your bilateral pedal pulses. Bilaterally bounding, strong. And I'm gonna check the dorsipedal pulse. It's strong and bilateral. Okay, I'm just going to check for, you can just put pressure and then push back against me, you're pressing the gas pedal. Okay, bilateral strength on the feet as well. Just gonna have you get up and do some gait movements with me. Feel okay? Lower
Yeah.
back. No edema on the legs either. Gonna have you take some steps forward with me. Okay, and back. And before you sit down, I just want you to lift one leg up and the other. Balance is okay. Okay, good, have a seat. Mobility is also good, the gait as well. During the assessment, I see that you don't have any rashes, no swelling, no edema, no pressure ulcers, the skin is all intact, and no pain other than the 3 on the lower back, which we'll look into. Okay, thank you for allowing me to do the assessment, and I hope you stay safe.
Thank you.
Okay, you're welcome.